If you're finding yourself having a strong reaction to sex, or you're distressed about sex, whether it's before, during, or after, there is a chance that there's some sexual trauma in your past. Understanding issues that you're having sexually as being caused by previous trauma helps in numerous ways. First of all, it takes away the shame that we feel, because suddenly we go from understanding this issue, let's say low sexual desire, as oh, the low sexual desire I'm feeling is because the sexual arena is a pretty stressful place for me. So I tend to not want to go there. And hence my sexual desire will lower itself over time because I don't want to go there. It's triggering for me. So understanding it from, oh, that's because of the trauma that happened to you when you were younger, let's say very young, and you had a babysitter that was touching you in ways that were secretive and didn't feel good. So you could see these issues as issues that are just there because they're there, and hence they're in some way, some people think intentional or something innate. And that is difficult because then the shame is like, what's wrong with me that I don't have the sexual desire? Why can't I do anything about this? This is my fault. You feel a lot of shame. But when you understand it, oh, my low sexual desire is because, when I was 6 or 7, I had a babysitter that did things to me that were secretive and didn't feel good. And now when I get near the sexual arena, I feel a lot of anxiety, and hence I don't want to go there. So my desire goes lower. It also makes us more effective in the treatment, because if we understand, hey, whatever's happening now in your sexuality is about trauma, not about other things that we tend to think about, like your insecurities or your negative or relational conflict, but rather trauma. Trauma has a totally different treatment than these other things. So again, understanding it from trauma takes away the shame and also makes us more effective in the treatment. So we go from feeling there's something wrong to us to something happened to us. Let's start with defining what sexual abuse is. I tend to ask about it in this way. Like when you were growing up in your younger years, under 20, and by the way, sexual abuse can happen definitely over 20, but it's good to get the conversation started. Like, did anything kind of funky or something that felt yucky or inappropriate, especially if it had any type of sexual or like romantic flavors to it? Did anything like that happen while you were growing up? I mean, it's a soft start. It's not like, were you sexually abused? First of all, some of us are so confused about our sexual abuse that it's difficult to even, part of the treatment is to identify it as sexual abuse. You're this person, I'm going to just open up about my sexual abuse? That's not easy. That's not an easy thing for me to do. Hence, I don't even want to think about it that way. I don't even want to think that happened and that means that. I don't want to go there. So beginning conversation a little bit softer and a little bit more expansive too, because we tend to think about sexual abuse as a particular thing. It's non-consensual, it's forced, and usually it's penetrative. But sexual abuse is so much more than that. It's just about feeling uncomfortable with what another person is doing, that it feels violating, that it feels uncomfortable, that it feels yucky, that it feels secretive. And especially if there's this secretive aspect to it, then that could definitely be sexual abuse. So just being, shown some porn on some magazines when you're 9, even though it's exciting to see it and you like it and you go back to it, could have some negative effects, because if in the moment you were being shown that, you felt uncomfortable, you felt like you were confused and didn't understand, then that definitely could have some ramifications for you in the future. Yeah, so a lot of times, we don't label these past experiences as sexual abuse, but we can say, well, that was uncomfortable. Well, that was weird. Well, I don't know why I had to keep that a secret. So that's important. The impact of sexual abuse is long, or the potential impact. Let's start by how many people are actually affected by sexual trauma or sexual abuse. The conservative research says 1 out of every 4 women, let's talk about women, and women, it seems to happen more than men, but I don't know, the research seems to be a little wanky on that, because men that perpetrate are usually sexual abuse survivors themselves. So if they're perpetrating all these women, they were perpetrated themselves. So I'm guessing it's probably half and half. So there's that. But as far as the women, which they feel happens more often, they say 1 in 4. But I think that has a very limited definition about what sexual abuse is. I think with the Me Too movement, we noticed that it is a lot more than 1 out of 4. I probably would say 3 out of 4, to be honest. It is that prevalent. 94% of women that experience sexual trauma develop PTSD within 2 weeks of going through it. 33% of those have long-lasting PTSD symptoms. 47% of survivors report depression at some point in their lives. Survivors are 6 times more likely to develop anxiety disorders. They are 13 times more likely to experience agoraphobia. And this is a big one. 47% of survivors experience some form of substance use or substance abuse. 33% of survivors contemplate suicide. 13% of survivors have attempted suicide. 30% of survivors experience some sort of dissociation, which could be severe enough to classify as a dissociative disorder. 40% of survivors experience some form of relational issues. Survivors are 2 times more likely to develop sleep disorders. 30 to 50% of individuals that have experienced some sexual trauma develop eating disorders. As if that's not enough, sexual trauma or abuse affects our relationships. Not only do they affect the day-to-day relationships, they affect specifically our intimate sexual relationships. Why is that? Why does it affect the relationships? Well, first of all, if you are anxious, depressed, dissociated, have PTSD symptoms, it is difficult to navigate relationships because you're in hypervigilance, anxious state. You have some fears, you have trauma, you're triggered. Your partner may not understand your triggers. You may not understand your triggers. And so it creates a more difficult layer to the relationship. Sexually, it's even more so because it doesn't happen for all people that have had sexual trauma. But for a lot of them, it makes sense, right? It makes sense that if you've had some sexual trauma, things are going to happen in your sexual relationships. One thing is triggers. If, like, for example, you were raped whilst you were being choked, you might get triggered if your partner tries to choke you during sex. Or the flip side of that, you may want to be choked all the time because that's what gives you pleasure, because we try to recreate our sexual abuse in a way that we can control. So saying, choke me, I'm telling you to choke me. You're not choking me without my consent. I am actually telling you to choke me, which is healing for a lot of people. If you had a bad experience and sexual abuse is a bad experience, you might be avoidant of that. You might be in some way not wanting of that, low sexual desire, or even avoidance, or even repulsion. Sexual abuse can show up in hypersexual behaviors because it gets imprinted on us that our value is a sexual one. And hence we are going to search for that value. Like if I learn that my value is a sexual one, that's what I'm going to be seeking in a very compulsive, obsessive way. Sexual abuse messes with our body image too, because when we're violated, our boundaries, our sense of self, it's like a kaleidoscope because it's almost like a shattered glass. It's a penetration that's so devastating that your whole body feels like in pieces. And so you don't know where your boundaries are and who you are. So when you look at your body, it doesn't feel right and it doesn't look right. Those are some of the issues that can come up from having sexual trauma in the relationship and in the sexual relationship in specific. So how do we deal with sexual trauma? What do we do? First is awareness. With any change in behavior, the first step is awareness. So being able to understand, oh my God, what's happening to me today has to do with this thing that happened to me in the past. And by the way, this thing that happened to me in the past was actually traumatic. And maybe before I was seeing it as something that wasn't a big deal. And by the way, if somebody could have a traumatic event happen to them and they say it didn't affect me, and I take their word for it, there are some people that are not affected by this, but a lot of them are. So you want to say, oh, this is happening to me because of what happened to me in the past. The thing that happened to me in the past, by the way, was traumatic, is traumatic. It was not something that should have happened to me. And I lost power, control, and agency in that moment. And it created this situation that I'm feeling right now. That's raised awareness. And it's raised awareness about what's happening now and also what happened in the past. And what's great about raised awareness is, first of all, it validates us and normalizes it. Like, oh, you mean I'm like other people that have had this experience? Suddenly I go from like, there's something wrong with me individually to like, oh, there's a whole group of people out there that this has happened to and they have felt the exact same way. And that is soothing to me because at least I'm not a monster. At least I'm not a freak. Also, the increased awareness now gives us a direction for work. Now we know that in the past it was trauma, so we need to heal that trauma and the consequences to that. And we also need to work on the shame that comes up due to that past and due to what's happening now. So the first step, like we just did, is to change the meaning and the reasoning behind it. So we're going to understand this as not our fault, not our responsibility. We did everything we could. We learn about sexual abuse and what typically happens and what should have happened that didn't happen. So now we're changing our meaning making. We're changing the way we understand this from like there's something wrong with me to know that something happened to me. If you lost power, control, and agency in a traumatic way, guess what the treatment is? Increase power, control, and agency. That's it. It's very simple. Very difficult to do, but it's simple. So if you can focus on anything you can do to increase power, control, and agency, and sometimes to an exaggerated way to get it more towards the middle, then that's the best way to go forward. And anything that takes away power, control, and agency, do not engage with it in almost like a hyper fixated way at the beginning, because you've got to change these behaviors that can be around for decades. And the only way to do it is to be really strong with it and exaggerate it. It's only for a period of time, and then you can play around with being a little bit more flexible with these things. And raising power, control, and agency starts in the therapy room, by the way. If you have a therapist that is pushing you or making you feel less powerful or is trying to control what you do or how you feel about something, especially the push, because I think that can happen to a lot of us in therapy. It's like the therapist has this agenda and they do it's with good intention. It's like, I know that this is the right way for you. If you just did this, I know things would get better. Let me push you a little bit. But pushing and trauma do not work. Sometimes it helps to think about how would we react to a young person that is traumatized and is exhibiting all the behaviors that we're experiencing. We would suddenly be very empathetic to that younger soul. We would know exactly what it needed and exactly what we needed to do, or at least we would know that if they're traumatized by going in the water, that we're not going to just throw them in the water, that would be horrific, that we have to in some way create some sense of safety for that person to go into the water eventually. You also stop the shame and the self-flagellation that happens because, again, any behavior that feels coercive, even subtly coercive, stay away from it. Back out of that. Don't do it. Be strong about it at the beginning. Your body needs to trust you. It doesn't trust for really good reason. Something horrific happened to it, and how does it know that it's not going to happen again? So if you're pushing it to do something, especially sexual, think about it. Like, how close is that to what happened to you in the beginning? And so you're doing more of the same. It's bad even if you don't have sexual trauma. A lot of people develop trauma because they put themselves in sexual situations that they don't want to. Begin to celebrate the no's. Again, increasing control and agency. Anytime you say a no, instead of feeling like guilty about it or having your partner feel angry because they don't get what they want, to be actually a celebration. Like, when I say no, I'm moving forward. Actually, I am moving forward in my healing process. Maybe you want to be touched all over your body and feel great about it. But anytime somebody touches your hips, you freak out and the whole fun is over. Yes, you want to be able to be touched on your hips, but you can't because you have trauma probably relating to being touched in your hips. So this is a process of increasing our knowledge of what do we need and what do we want. And what we want is also very important. And to be able to not just understand what we want and need sexually, romantically, but then to be able to express it. Because it's really scary to express in general what we want and what we need, specifically in this area, because anything around this area is anxiety provoking. These are kind of my bullet point list of treatment for sexual abuse, which is crazy that I would even go with a bullet point list of such a short amount of things. But sexual abuse treatment is hard and it might require some professional help. Take these ideas and this explanation as a way to be validating and supportive and giving you some things to think about, right? But get some professional help. This really is a difficult thing to go through, first of all, without any type of help. And it's a difficult thing to treat because there's a lot of components to it. So get somebody that knows what they're doing, somebody that actually specializes or at least is trauma informed.